to chapter 1 of our course. This is so exciting. What a day and age that we live in, man. Our quarantine lives right now are pretty chaotic. I just recorded this entire lecture before with video, and here I am thinking I'm all nifty and I got it all figured out, except for the video had no sound. So all it was me. You could see my lips moving, and unless you're really good at lip reading, you weren't going to get anything out of that lecture. So round 2, hopefully this will be the winner. Please forgive me if I am interrupted by 2 little kids or my husband who come in the room. We are all working from home and it is a little bit crazy, but I'm sure you all can imagine you are living through the same things we are. So let's go ahead and get started. Chapter 1, History of Respiratory Care. So there is a lot of information in this chapter. And if I can just give you maybe a tip for success, I would say that you should use these PowerPoints as guides as you go through the chapter. I wouldn't recommend sitting down and just reading the chapter from front to back and highlighting and trying to remember everything. It will take you forever. That's not me saying that I don't think you should open the book, because I definitely think you should open the book and look through the chapter, but I would say that you use these PowerPoints as guides to what you will focus on in the chapter. So if you're, just use it as guides. Simplify it a little bit. Make it a little more easier and a little more understandable, rather, for you guys to be able to take in all of this information. So let's go ahead and get started. These are the learning objectives for this first chapter. I'll let you go through and check those out. Those are basically just the goals of what we want to be learning by the end of this. And we'll start off with the first one. What is respiratory care? Respiratory therapy, it's a discipline of the healthcare system where we specifically specialize in cardiopulmonary function. Another little tip. Throughout this whole PowerPoint and in future PowerPoints to come, there will be highlighted sections of the PowerPoint. They are crucial for you to understand and know, and they are also keywords that could be on tests and finals and midterms. So wherever you see something that's highlighted, such as this, I would definitely take note of that and make sure that you are familiar with the information that surrounds it. So to get back to it, respiratory therapy specializes in the promotion of optimal cardiopulmonary function, anything relating to the heart and lungs. And a lot of time that includes, that includes the kidneys as well. All 3 kind of work together to make sure that the other functions, and if one is out of whack, all 3 become out of whack, or can become out of whack, I should say, more than likely. So focusing on the cardiopulmonary system, understanding the functions, what each does, how it affects the other, what tools we use to be able to monitor those systems are all key pieces of information to be able to be successful in respiratory therapy and taking care of our patients. Respiratory therapists specifically apply scientific principles to prevent, identify, and treat acute and chronic dysfunction of the cardiopulmonary system. So in a nutshell, that is the job definition of a respiratory therapist. Going all the way back to the history of medicine and science, all the way back to Hippocrates. This guy, the father of medicine, he kind of got the ball rolling in asking these questions. How does the body work? What affects the body? What distinguishes between a healthy person and a sick person? He had this idea that health was based on 4 essential fluids, so phlegm, blood, yellow bile, and black bile. He believed that the air contained something in it that was distributed into the body. Air contained essential substance distributed to the body via the heart. So I didn't explain that very well. Basically, that the air contains something that creates life in the body, and that substance is pumped throughout the body by the heart. And maybe many of you have heard about this Hippocratic Oath here. This is what is given to medical students as they graduate from medical school. It's just this idea that they will perform using ethical principles, they will do no harm, just that you will do what's best for the patient and work within an ethical manner. So was a pretty influential guy in medicine as far as I'm concerned. So that was kind of in ancient times. Moving forward to the Middle Ages, we have this fallout of the Western Empire during this kind of the Dark Ages, I guess you would say. Weren't very many there wasn't a lot of scientific development, not a lot of progress. But then in this intellectual rebirth, we had a lot more ideas coming forth, a lot more people asking questions and studying and doing experiments. Leonardo da Vinci, Andreas Versailles, all of these guys, you can go on and read all of their little key pieces that they've added to the respiratory puzzle. We couldn't have done it without Leonardo da Vinci, who determined subatomic atmosphere pressures inflated the lungs, So I won't go over every single one of these because all I would really be doing is just reading them, and you can do that. So we have the Middle Ages. We moved forward to the Enlightenment period. More properties of science are discovered. Properties of carbon dioxide, and then we learned about oxygen and its consumption in tissue respiration, and Charles' laws of temperature, gas, laws of volume, all kinds of things that, again, add to this piece of the respiratory therapy puzzle. Moving forward to the 19th century, a lot of advances were made in physics, chemistry, and respiratory physiology. The law of partial pressures. You'll learn all about the law of partial pressures. This is just this idea that negative and positive pressure, how they work within the lungs, how they allow the lungs to draw in air and then to expel that air, how gas pressures and temperature are related to those functioning pressures. The law of partial pressures is absolutely crucial to the function of the respiratory system. So this was a pretty crucial discovery. Diffusion of gases also was pretty key in being able to help respiratory care be what it is today. Moving forward in the 19th century, more medical advances, further advances in bacteriology. Bacteria causing tuberculosis and cholera were discovered. So because it was discovered, then we can work on finding cures for those things. Much of these things, like I said before, they're all pieces in the puzzle. So the measurement of blood oxygen and CO2 content, we have the respiratory quotient, which we use all the time in the respiratory program. Demonstration of carbon dioxide is a major stimulant for breathing. You have to have CO2 in order to breathe. I feel like I'm just really talking a lot, you guys. I'm sorry. I feel like I just wish you could see my face, but you can't. But if you could, you would see me totally out of breath talking about each and every single one of these pieces of information. Like I said, just go through, familiarize yourself with these advances, look at them as bits and pieces of information that have built respiratory care to what it is today. Let's see. We're going to scoot forward to the development of respiratory care profession slides. Basically, these are key components of what respiratory therapy focuses on as we care for our patient. So let's start out with, I think I might have skipped one. Blah, 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 blah. No, I didn't. We'll start right here in oxygen therapy. Here are some of the advancing dates of where oxygen therapy started and where it is today. But in the 21st century, the use of O2 concentrators with pressure boosters and smaller, lightweight, portable oxygen concentrators was introduced. So not until the 20th century have we been able to have oxygen concentrators that are small and lightweight and portable. So that's pretty key information, and really revolutionized the quality of life for a lot of our homebound patients with COPD and with all kinds of other respiratory ailments who necessarily don't need to be in the hospital all the time, but need to have oxygen so that they can function properly in their homes. So that was a really big development. Moving forward, the 1960s, we've got the Clark electrode, which measures arterial oxygen content, Venturi mask, which delivers a specific FiO2 to a patient. FiO2 stands for fraction of inspired oxygen, and that, you've got these sick patients. You want to make sure that they're breathing in I look at it as a prescribed amount of oxygen. So they have this prescribed amount, this prescription essentially, of how much oxygen they're supposed to be having. And so using this venti mask, and we call them, I'm pretty sure that it's similar to the Venturi mask that we use today, but they allow you to deliver that specific FiO2 or that specific prescribed amount of oxygen. And then we have pulse oximeters that are developed here later in the 1900s, which are key tools in the respiratory profession today, monitoring the oxygen saturations of patients. They alert you when things start to change, when things start to, oxygen saturations start to dip. That's usually a key indicator that something is going on. So another important tool in being able to properly care for the respiratory, cardiopulmonary, and renal systems of our patients. So we started off with oxygen therapy. We're going to move forward to aerosol medications. Respiratory therapists deliver a lot of medications, and more often than not, the medications are aerosolized. You might have seen a patient or somebody having a breathing treatment at home or in the hospital. They have a little mask, and there's a medicine cup in there, and you pour the liquid medicine into the cup, and that device aerosolizes the medication to a gas and allows that patient to breathe it in so that it can be fully deposited into the lungs. So it's a pretty revolutionary idea, and it's absolutely critical to our patients today as well. You know, you see these people having these breathing treatments, but at least I didn't think of it. We give these aerosolized medications to patients who are on ventilators as well. So we're able to not only deliver it to patients who are awake and coherent and can hold their own aerosol mask, but also to patients who are sick and who are on ventilators, who may need bronchodilators or any other type of therapy through medication. We can deliver that through aerosol therapy. So it's pretty incredible. Mechanical ventilation is another, probably the bigger part of respiratory therapy. The most intimidating part, especially for me right now, just this incredible idea that we can have machines that work for people's lungs. It blows my mind. Respiratory therapists have to know what makes mechanical ventilation work. You need to know the ins and outs of the ventilator and your patient, and finding a way to sync them together, that ventilator and the patient, in order to function properly. So it's a very sensitive dance to be able to make both of those work, and specifically that's your job as a respiratory therapist. So more often than not, we use positive pressure ventilation now. We have positive pressure ventilators, but before we had those, we use negative pressure ventilators, and specifically, maybe some of you have heard of it, this iron lung that was developed in response to the polio outbreak of the 1940s and 1950s. It was very popular to have people be on this iron lung. The tricky thing with that is that they were bound to it. There wasn't much that, I moved off this picture because I needed to read, but you can see it here. All of these people, they're in these machines. They can't get out of the machines. This is what's keeping them alive, is this negative pressure iron lung. So it was a very revolutionary idea for these patients, but it's not a solution for, long-term patients. It's something that is, in fact, maybe I'm wrong. No, I think there are people that live their whole lives on an iron lung, but you're bound like this. You're not mobile. You're not independent. So you kind of look at it. It's got two sides of the sword. It keeps you alive, but at what cost? What cost to your quality of life? Regardless, absolutely revolutionary and incredible that this iron lung was developed and able to take care of these polio patients. Moving forward, like I said, we now use positive pressure ventilation, but it was originally only used during anesthesia. So these ventilators weren't even introduced. These positive pressure ventilators weren't even introduced until the early 1900s. But now we've got all kinds of ventilators. We've got different brands, different names, different types. We've got hospital ventilators and home ventilators and all kinds of ventilators for all kinds of people, and it is your job as a respiratory therapist to know how to work all of those ventilators, all of those different modes, and how to pick certain modes and certain vents for the pathology of your patient or the condition of your patient. So it's pretty in depth to be able to learn this mechanical ventilation and apply it to specific patients, but it's very rewarding to be able to breathe for them. It's really quite incredible. So mechanical ventilation, a key role of a respiratory therapist. Airway management is also another foundational role. Being able to maintain a patient's airway, being able to protect their airway, being able to establish an airway sometimes. Airway, keeping that patient's airway available and patent and functioning keeps that patient alive. So your job as a respiratory therapist to do that is absolutely vital to keeping that patient alive, and it needs to be taken seriously, and it's incredible. Like it's a lot to witness, but it's very rewarding. You have these tools here that are used primarily to this laryngoscope here to establish that airway if we're intubating a patient and needing to put them on a ventilator or establish an airway with an ET tube. This is the tool that's used to open up the mouth and be able to visualize the vocal cords to insert the ET tube properly. This is the kind of the side profile view of how the ET tube sits in the patient's lungs, down here through the trachea, right here at the base before it's called bifurcates here into the right and left lung. And then this is a Yonker, which we use for suction to kind of clear away those secretions and keep the airway clear. Sometimes you get some patients that have really thick, gunky secretions that can actually occlude their airway. So it's crucial to be able to clear those secretions and keep them out of that airway, not only so that they can breathe and have their airway open, but also so that those secretions don't just sit there and collect and then develop bacteria that further goes down into the lungs, and then you've got a pneumonia on top of an already critical situation. There's just so many factors, and you'd be surprised how much suctioning really does help a patient be healthy. So then we've got kind of our diagnostic tools. We talked about the pulse oximeter a little bit earlier. We use that to determine the oxygen saturation in a patient's blood. But then we have these cardiopulmonary diagnostic tools as well. We've got spirometers that measure the, I'm pretty sure it's the volume of air. Yes, volume of air, sorry. To measure the volume of air, and then we've got arterial blood gas analysis machines, which, you take this sample of blood from a patient and you're able to determine, okay, what's their partial pressure of oxygen in their blood? What's the pressure of carbon dioxide in their blood? Okay, what is their bicarb level? You've got all of these different pieces of the puzzle that are allowing you to have this bigger picture of how the heart and the lungs and the kidneys are all functioning and how to manage that patient based on those numbers. So it's key information, absolutely crucial to be able to know about your patient and take care of them properly to have an arterial blood gas. So that was a pretty big development. And then we've got these pulse oximeters that I talked about, and then polysomnography is a sleep study. Those are pretty common these days, most often for people with obstructive sleep apnea. But there are other types of apneas as well. You've got central sleep apnea. There's all kinds of branches off of this polysomnography that help people have a better quality of life. You're not living in a hospital as a result of a sleep study, but you might be able to be resting more soundly and go through the whole day without napping. There's a lot of risks that are associated with obstructive sleep apnea, so polysomnography was pretty critical to helping people be healthier overall throughout their lives. We'll move forward to professional organizations. The respiratory therapy field is full of professional organizations. Highlighted material, dun 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 dun. The primary influential association here would be the AARC, this American Association for Respiratory Care, founded in 1982, so not even that long ago. And this is, no, that's not the state. You have your state licensure, And then you have your national licensure as well. And state licensure, it's a hard word to say, wasn't even established until the 80s. And in order to receive that state licensure, you have to be able to pass your boards. You're passing this passing exam that is being talked about, and that is offered by the National Board for Respiratory Care. They're the ones who orchestrate the exams, who write the exams, who proctor the exams. So pretty influential people in the field of respiratory care, helping to educate the incoming therapists and keep medicine moving forward. Moving on, this is all about the education that is required of respiratory therapists. It used to be very common that therapists would just learn on-the-job training. That has progressed to therapists needing an associate's degree, a 2-year program, and it is now the most common practice to have a bachelor's program. You will still find many therapists that have an associate's degree, and which is fine, totally fine for them. But moving forward, the field of respiratory care is trying to make their certified programs to be bachelor's programs. So if you're looking into the respiratory program, whether it be Weber's or any other type, I would highly suggest to keep an eye out for bachelor's programs. That way, when you're finished, you'll be able to be a competitive candidate for those roles that you want to apply for. Let's see, did I skip that? Nope. We got this page, and we got this one. More information about the degrees. Jeez, it's moving forward a lot. We are living at an interesting time to be respiratory therapists, right, with this whole COVID thing. Not only that, but we have these baby boomers who are coming into that retirement age and getting into their elderly era. And with that comes a lot of disease processes and the results of a lot of smoking, and vaping even now is becoming a big issue. So we've got these baby boomers who are suffering from asthma and COPD and other cardiopulmonary diseases, and there is a lot of them. So in a sad way, it's job security for respiratory therapists, but there's a really big need for competent respiratory therapists to be able to take care of this age population of our patients. In the future, moving forward, these are the areas of focus that the field of respiratory care is focusing on: prevention, protocol administration, care plan development, disease management and rehabilitation, family and patient education, and tobacco cessation counseling. And I would even add education with vaping and the cessation of vaping as well. I suspect that in the coming day, vaping will be the new smoking epidemic, and a lot of education and prevention is going to need to go into keeping our patients healthy and educating the community just about how detrimental the effects of vaping can be. So this is kind of moving forward in what the future of respiratory care looks like. Excuse me. In order to determine what that future of respiratory care looks like, the goal is to be able to answer these 5 questions. So the future of respiratory care: how can patients receive healthcare services? How will those respiratory services be provided in the future? Knowledge, skills, attributes needed for future respiratory therapists, educational and credentialing systems, what is going to be necessary for the future of those RTs, and how to transition with little impact on practicing RTs. This is something that's very interesting because of the different range of, what's the word I'm looking for? Just the amount of, you've got these baby RTs coming in like me who don't know anything, right? And who are learning, and then you've got these, on the other end, these RTs who have practiced for years and who are completely competent and educated and have learned things in a certain way. And then, these babies come in and saying, hey, we learned it in a different way. It's evidence of the continuing evolution of medical care and respiratory care. So how do we how do we unify those therapists? How do we make the changes that we need to make for our patients, but also do it with little impact on respiratory practitioners as possible? So that's pretty important. And then finally, we have these areas of competence that are crucial for a respiratory therapist. These are 7 areas that I feel like as a therapist you want to be confident in. This is your role as a respiratory therapist, to be able to maintain these things, and it's crucial in order to be successful and to take care of patients, to be able to have these major areas of studies. So we've got diagnostics, we've got chronic disease state management, evidence-based medicine and respiratory care protocols, patient assessment, leadership, emergency and critical care, and therapeutics. So there you have it, Chapter 1, ladies and gentlemen. A lot of information, a lot of dates, a lot of people, a lot of organizations. Like I said, go back through your chapter, use the PowerPoint as a tool to guide your reading, and go over the highlighted sections of the PowerPoint and make sure that you know the information surrounding that highlighted area so that you can be successful in your quiz this week. And don't forget that these questions can also be on midterms and finals, so make sure that it's information that you take the time to learn and to know. But I'm excited to work with everybody. That's going to be a great semester. And if you have any questions, you can always email Heidi or myself. And we'll talk to you next week. Have a good one.